it going? Dr. J here with Thrive Spine Center with another powerful, inspirational health message. And today I wanted to go over the most powerful organ system in the body that can be interfered with. This organ system controls all the health, healing, and functioning in your body, and like I said, it can be interfered with. So, what do you think that is? Well, if you thought brain, spinal cord, and nerves, you're exactly right, because those comprise your nerve system. Your nerve system is really the foundation to everything that is you. That means that everything in your body is completely 100% dependent upon how well your nerve system is functioning. Think about it this way. In order for your heart to beat, your lungs to breathe, for you to be able to heal of whatever it is that you're going through, whatever ache, pain, ailment, sickness, disease, whatever it is, what has to happen is your brain sends down these health and healing messages that are carried down through the spinal cord and out through the nerves into every single organ, tissue, cell, and muscle of your body. You see, your brain is in constant communication with your organs, your tissues, and your organ systems, and those tissues and organ systems are in constant communication with your brain. Well, guess what? All that communication takes place across these nerves, and it happens at 200 miles per hour. It's that exchange of information that keeps you functioning properly, and it's also how all healing happens. So if there's ever any breakdown in that communication, you simply move away from health. I like to ask this question a lot in my workshops. If I had a dead guy down here and I gave him all the vitamin C in the world, would he come back to life? Would he come back to life if I rubbed essential oils on him? Would he come back to life if I gave him all these drugs, right, and did all these things to him? Would he come back to life? And the answer is no. You see, your nerve system is your power supply. It's your most important system in your body. So the guy, the dead guy down here, he wouldn't come back to life, right? Are you dead when your heart stops or your brain stops? You're dead when your brain stops. They've brought people back to life. Their heart stops. They're able to resuscitate them. They, use the defibrillator thing. They get them back to life. But you are dead, technically, when your brain stops working. Now, here's my next question. What structure houses and protects your nerve system? Well, if you thought spine, you're exactly right. You see, your spine houses and protects your nerve system, and that's why we chiropractors even look at your spine. It's not that we're back doctors or spine doctors, we're doctors of the nerve system, because if you have any interference to your nerve system going on whatsoever, your body cannot fully function and heal at 100%, and that eventually leads to dis-ease, or a lack of ease in the body, which leads to disease, sickness, and an early death. All right, let me give you a gross example of this. If I cut the nerves going to your heart, what would happen to your heart? Your heart would stop beating, and you would what? You would die. If I cut the nerves going to your lungs, what would happen to your lungs? Your lungs would stop breathing, and you would die. But what would happen if I shifted this bone out of its normal position and it pinched and choked on the nerves going to the heart? Would your heart still beat? Yeah, it would still beat, but would it work at 100% of its full capacity? No, it would not. It wouldn't work at 100% of its full potential, okay? So when a bone shifts out of its normal position like that and it pinches, chokes, irritates on the nerve, okay, what do we call that? Well, we call that subluxation. Say it with me. Sub meaning less than, lux, light, ation. Subluxation. It's as if you had a dimmer switch, and that dimmer switch had been turned fully down because you have irritation on the nerve root. And so here's the problem. The reason why subluxation is so devastating to your health and well-being is because when a bone rotates out of its normal position and irritates that nerve, okay, it's going to negatively affect whatever organ, tissue, cell, muscle that nerve goes to and controls, right? So if I subluxated this bone right here and it pinched, choked, irritated the nerves going to the thyroid, would your thyroid work at 100% of its full potential? No, it would not. So is that a belief system? No, it's not a belief system. That's a law of anatomy and physiology that when you have interference to your nerve system, your body cannot fully function and heal at 100%. And here's the thing. People will tell me that they don't believe in chiropractic. The problem with that is chiropractic isn't about belief. It's not about belief. All we do as chiropractors is work with these natural laws of health and healing. So we work on correcting the spine, right? We work on correcting the structure and integrity of the spine. So think about it. If we correct the structure and integrity of the spine and remove neurological interference, don't you think that your body's going to function so much better off because of that? That's what we do as chiropractors. We correct subluxations because subluxations are absolutely devastating to your health and well-being. So here's my number one recommendation. The number one thing that you need to do for your health is make sure that you have a spine that's in alignment, right? Because you want the most optimum brain-body connection, body-brain connection that you could possibly have. You want to free your body of any neurological interference whatsoever, because the nerve system, like I said before, runs, controls, and coordinates every single solitary function in your body. So you want to make sure your nerve system is free and clear of neurological interference. And how long do you want to do that for? Well, you want to do that for the rest of your life, whatever that takes. So in my office, we don't guess, we test, especially when it comes to your overall health and well-being. So I have a digital X-ray machine, and we take before and after pictures of our patients' spines so that we know we're moving in the right direction. Because the whole point is to correct what's going on in there, right? To get the spine into a more stable position, to get pressure off the nerves so you can experience health and well-being for years to come. A higher quality of life is lived without neurological interference. I mean, listen, Hippocrates, considered the father of medicine, said, look to the spine, look well to the spine for the cause of disease. I'll say it again. Look well to the spine for the cause of disease. I mean, he knew it back then, and they didn't have X-ray technology. He knew how important the spine was to his patient's overall level of health and well-being. So, if you know somebody who's sick and suffering right now, right, who might be on a ton of medications needlessly, and they're not living a quality of life, you can confidently refer them into a chiropractor. And here's why. It's not that chiropractors are symptom chasers. Well, at least corrective chiropractors. I'm not a symptom chaser. In fact, the only thing that I diagnose in my office is spine problems. The only thing I diagnose in my office is subluxation. I don't diagnose anything because of that. But I've been able to help people who've had chronic migraines, headaches, vertigo, okay? I've helped people get feeling and function back into their hands and into their legs. I've helped people suffering with sciatica type problems, right? Because, you know, the bone in their lower back at L4, L5 was shifted and it was irritating the sciatic nerve. So, right? So if you deduce that down, what do you have to do? You correct the spine, get the pressure off the nerves, free up the neurological interference, and their bodies get a greater function and heal. Because of that, I've helped people with lower back pain, neck pain. I recently had a girl that was on 800 milligrams of ibuprofen. She was taking that ibuprofen 3 times a day. We're going to get her on here on video to film an actual testimonial of that. She was taking ibuprofen, 800 milligrams, 3 times a day. Think of how crazy that is. Where would she be 10 years down the road if she continued to do that, right? Because all of that has to get filtered through the liver and the kidneys. That is going to rob her body of life and vitality. But she got off the medications, praise God. And that's what I hear all the time, is those really cool testimonials. We've had people telling us that they're that they're sleeping better, that they have increased energy levels, that they're thinking clearer thoughts. All these things people don't associate with chiropractic, but when your body is functioning at a higher level and it's performing its functions on a more efficient level, what's going to happen? Your body's going to heal and the symptoms are going to magically go away, because that is the whole idea of health. When you start removing, when you peel back the layers on what's causing the health problems versus chasing the symptoms, right, you can actually experience a greater life lived. Because if you deal with the cause of the problem, okay, the symptoms will oftentimes take care of themselves, right? Medicine, Western medicine, is very good at managing disease, managing the symptoms, keeping the symptoms at bay. But as far as taking a proactive approach to health, as far as prevention, as far as dealing with the cause of the problem, not necessarily the best. It's more about treatments. And I'm not saying there's anything inherently wrong with that. There's a lot of great MDs out there who really care about their patients, and sometimes the drugs are an absolute necessity. But what we see here in America especially is so many people on drugs and medications, taking those day after day, and then they end up suffering, you know, later on in life when we're supposed to be living the golden years in our life. They're stuck in nursing homes, or, you know, they have a colostomy bag because they've had to get their colon removed, or they're on all these drugs. I forget what the statistics are, but I think the average American, by the time they turn 45, is already on 2 medications that they're taking on a regular basis. And they're taught and trained that they're going to have to take these medications for the rest of their lives. Well, I don't believe that to be so. I think when you begin to peel back the layers and start removing the interference, you know, especially neurological interference, you start eating better, you start thinking clearer thought, you start thinking better thoughts, you know, because your brain and the way you think has a lot to do with your overall health. You start laughing more instead of being so stressed out all the time. You focus on, you know, your spiritual life. You get into meditation, right? You pick up the Bible, you read the Bible, whatever it is, you know, you're doing things that are taking you towards greater health and well-being. You start moving on a regular basis. You know, statistically, if a person walks 20 minutes a day, 5 days a week, they're going to reduce their risk of suffering from a heart attack by 50% simply by getting outside and walking on a regular basis. I personally go to the gym 3 to 4 times a week, and I have my routine that I'm absolutely in love with, and I like to do different things, move my body in different ways, because I'm always trying to challenge myself. I do a lot of one-footed exercises. Anyway, I digress. Movement plays a huge role in overall health. So, you know, you begin to remove toxins. My buddy Dan Root just opened up his detoxification center where they focus on sauna and niacin. I have other colleagues and professionals that I'm networked with that focus on hyperbaric oxygen chambers that do all these cool things. So there's all these natural remedies for, you know, thriving in life, which is why I do what I do. My mission is to help as many people as possible thrive in life and realize their full potential, because I believe that each and every one of us were designed on purpose for an incredible purpose, and we can't live out our purpose if we're sick and unhealthy and tired and depressed and fatigued and we have all of these diseases going on. But I'm telling you, when you can get your body functioning and thriving at its optimum, that's where you have the most creative energy to get out there and do whatever it is that you do, whatever it is that whatever your purpose is, right? Health is the backbone. It's the backbone to creative energy to be able to push through any obstacle and go out and do what needs to get done. And no pun intended about the backbone. So anyway, I leave you with this today. Think about how powerful your nerve system is. I hope I inspired you today. Consideration about how your body performs, how it functions, and hopefully this will help you to look at chiropractic in a much different way. You know, there's a lot of people out there that are skeptical of chiropractors, but you know, I've been doing this 10 years now, and we've seen a lot of people heal simply by addressing subluxation, removing neurological interference, and adjusting their spine. You know, use thy hands to heal. That's what we do. So take some things into consideration, really take a step back. You know, hopefully this will give you a different perspective on chiropractors and what we do. And if you have a health problem or a health issue going on right now and you're not sure if chiropractic can help, what you can do is you can actually give us a call at 916-587-1276. We're located in Folsom, California. We are fairly close to the Folsom prison. We're actually on Blue Ravine and Folsom Boulevard, where those two meet, in the Mel's Diner parking lot. In fact, we're 2 doors down from Dominic's Pizza, a very popular spot. So you can always give us a call. I would be more than happy to answer any questions you have. We could set up a free consultation where you actually sit down with myself and we go over a very thorough consultation, find out exactly what your needs are, and then we move forward from there. I always do a thorough exam, and then we take any necessary x-rays that we need to take. We even take motion x-rays that that way we can see what bones are moving, what bones aren't moving, which allows me to be even more specific about what I do. But like I said, we don't guess, we test, especially when it comes to your overall health and well-being. So remember, align to thrive, make it a powerful day, take those things into consideration, and just really focus on being the best version of yourself day in and day out. Dr. J with Thrive Spine Center, signing off. Have a great day.